Again, how to do the special tray for the lower. How to do the special tray for the lower. What we need the primary cast gypsum type 2. I'm gonna mention the type of the gypsum all of the time. Gypsum type 2, it was used for primary cast. Primary cast, I need light cured acrylic resin. I need sheet of wax, okay, for the spacer. And I need 2 markers, different colors, and all like these instruments if you gonna adapt all of the wax or the acrylic. Now, what should we do? We have to drawing all of the time. The first one, the first line, which gonna be extended to the deepest point of vestibule. I gonna hold this pen perpendicular like this, and I gonna draw the first line, okay? It must be the deepest point of vestibule. The second line, it must be shorter 2 millimeter. And this line, which is shorter 2 millimeter, gonna present what? The border of my special tray. So my special tray gonna stop at that second line, which is shorter about 2 millimeter from the deepest point of vestibule. Okay? Why it must be shorter 2 millimeter? Again, because I need to capture the shape of vestibule, and I will not be able to capture the deepest point of vestibule or the shape of vestibule if I extend my special tray to the end. So I have to make it shorter. Why? To put another material on the border to capture the shape of vestibule. I told you the vestibule gonna be sometimes gonna be wide like this, sometimes gonna be narrow like this. If I extend my special tray border like this, I will not be able to capture this area, okay? It will not be easy. So I'm gonna make it about 2 millimeters shorter. Why? To put another material here. This material gonna capture the shape of vestibule. This is the purpose of why I have to make it shorter about 2 millimeters. And then we have the third line, which is 4 millimeters shorter. 4 millimeters shorter. Why this line? I need it for the spacer. Okay? There's gonna be a spacer here. I'm gonna make it in green. The spacer gonna be shorter about 2 millimeters. So it's gonna be shorter 4 millimeters from the deepest point of vestibule, 2 millimeters shorter from the special tray border, okay? Because I need the border of my special tray to have intimate contact with the ridge, okay? Here, the first line gonna be for the special tray. طب how we can measure 2 millimeter? You can use the ruler. You can use Prosthodontic probe. Prosthodontic probe is divided 1, 1, 1, and after that there are 3 millimeters. So it's gonna be easier for you. So you can just put it and make dots, okay? And the third line is gonna be shorter about other 2 millimeters. Mamusta Perez, I need fire here. Okay? Now we have 3 lines. The first line, deepest point of vestibule. The second line, the border of special tray. The third line, the border of spacer. Okay? But what about this area? Why I just make this area like a circle here? In this area and this area. This is the buccal shelf area, which consider as the primary stress bearing area. So I need intimate contact in this area to give all of the stress of the lower denture upon this area. Okay? I need this area to be a mucocompressive impression in this area. A mucocompressive in this area. Okay? The other areas here, it's gonna be slightly relieved by the spacer. Okay? I'm gonna use the wax as a spacer. How we gonna soften it? Not melt it, soften it. Okay, rapidly. Or you can immerse it in hot water only, which is gonna be easier for you. Now it's soft, so I can handle it. What should I do? I'm gonna put it on the lower tray like this, lower cast like this. Adapt it by my fingers, and I'm gonna cut all of the tongue space area. And also all of the borders here I can cut more. And now I'm gonna make sure that it will be on the third line. How I gonna know that? Because it was covered. You can see the line under the wax. It's easy to be visible. Adapt it. Complete adaptation. Make sure there is no voids underneath or there is no air underneath, and then we can proceed. Here for the buccal shelf, I have to cut all of the wax around this buccal shelf area, and then so we can proceed again here. If we consider the retromolar pad as a primary space-bearing area, I have to remove the wax from this area. But here we consider it as secondary space-bearing area, so I can leave some wax on it, okay? And here we have to do the same in the lingual side.
So you cut it in the second line?
No, the third line.
Retromolar pad.
All of it, yeah, retromolar pad gonna be the same. Yani both first and second and third gonna be the same. Okay, here they're gonna end at the same line.
So in the third line also continue.
Yeah, first and second and third gonna meet the same line. They are the same line. This is the limit. You can see it was cutting on the third line exactly, especially here I have to cut more. Yeah. Now it's done. Okay? You can see the border only on the third line. Okay, this is the spacer. What should we do also? because this is a general spacer, I put it only, not only to relieve the structure, I just put it only also to give a space for the impression material. Okay, يعني there is two purposes for this spacer. The first one, to relieve some structure, which is the residual ridge here, and also to give a space for the impression material. How to make sure that there is a space or get a space for the impression material? I have to draw a stubbers. Stubbers, I have to draw it before, but it's okay. We have to put it in the canine area, about 4 by 4 inches, milli. Square shape like this. Okay, canine area 2 here. Like this. Okay, two stubbers. Okay guys, now let's go for the specialty, acrylic. As I told you, we have this material which is light cured acrylic resin. It's gonna be activated by light, so I can handle it. I have unlimited working time. Okay, once it was exposed to the light, it's gonna start what? The reaction. Okay, what should I do? I have to locate it exactly, and as I told you, we have to start with the lingual part. All of the time we have to start with the lingual part. In the upper we have to start with the palatal side. Okay, and I have to cut the tongue space area. Then I have to adapt it easily. Don't thin it. Don't put a lot of pressure while you adapt it. Adapt it in very gentle pressure. Gentle pressure. Or you can use this to adapt. And then after that, I'm gonna make sure that it was adapted on the ridge, and then we're gonna transfer to the buccal side. So lingual, make sure it was fully adapted, then the ridge itself, then buccally. Okay, and the buccal I have to cut, but try to cut more, not exactly, slightly more, to make sure that you still have safe margin. Okay, then this area I have to push it inside like this. Push it inside. We forgot something. Nobody remind us. The stubbers, yeah. We have to put some of the acrylic before that. We have to put some of the acrylic on the stubber itself. It's okay. Type. What should we do now? We have to make it shorter, about 2 millimeters, right? You have the choice. You can extend it like this, and after that, after setting, You can trim it by micromotor, which is better for you as beginners, or you can cut about 1 millimeter of the length, and by trimming and finishing, it's gonna cut the second millimeter. So you have the choice regarding this. Now everything is fine, and we make sure that there is no voids without any pressure on it. Okay, now we have to fabricate what? The handle. The handle, as I told you, there is L-shaped handle, or it can be straight. Okay, if it was straight, it must be perpendicular, not like the upper one. The upper, it must be inclined about 45 degrees toward the labial, but in the lower, it must be perpendicular like this. Okay, and the handle must be in the middle. This is my reference, because when I have this special tray and it was filled with impression material, I can see how I gonna locate it inside the patient mouth. The only reference which I have is the handle with the midline of the face. Okay, so I have to make sure that the midline is ready here. This is my midline, and then I'm gonna fabricate the handle. If it was straight, it's gonna be about 4 millimeter of thickness, 8 millimeter of height, okay, of length. And also it's, to make it more retentive, I can make some lines here, some scratches. And as I told you, I have to make it wider from this area to increase the surface area. And then I'm gonna apply it like this, and I'm trying to blend it. Then I'm gonna make sure it is in the central line or the midline. It was not. Then I have to customize or adjust the shape of it. On the midline. Okay, fine. There is something called stabilization pads. I can put it on the molar side here. Okay, it can be used for your finger to stabilize the special tray inside the patient mouth. You can put it, or it's up to you. For me, the handle, it's more than enough. Okay, some of the schools, they can put the stabilization pads here and that's it, without handle. But for me, handle is much better. Okay, that's it. And then I have to put it inside the curing unit, okay, for 1 minute or 2 minutes, and then I'm gonna remove it and flip it upside down and put it again for the same time, and then I'm gonna start trimming with the bears, and then I have to polish it or finish and polish with the sandpaper. Okay, I have to hold it like this,
Okay.
supported, and this is gonna be for supported. And before the line, exactly. And we have to make sure. Here it's good. We need more here. And don't cut from this area. You have to cut only from the, yeah. I don't need to thin it. Still here is perfect, but still we need some. Here it's perfect, you can see. Now we have to adjust this area. There's some points here. More. Yeah. Now this is ready. What should we do? Only using the sandpaper. If it was more, it's gonna be better. gonna be so smooth, like here. So smooth. You're gonna feel it with your finger. What's he gonna do?
Only like
For what?
class free.
Give me 5 minutes. I gotta talk to him. Are you okay? You can see here there's about 2 millimeter all around. All around. Okay, 2 millimeter of space all around. And here too is the same. And this is the special tray. That's